Hello and welcome to this recorded presentation for the employees of CDM Technology of Michigan for the health plan beginning January 1st, 2023. My name is Bill Hammett. I'm your insurance expert, happy to help you through this process. If you need help choosing a plan, understanding the benefits, choosing a plan yourself, or finding doctors, whatever it may be, we're here to help you. Throughout the year, Rhiannon and Anna are available to help be your advocate in terms of claims, finding doctors, getting new ID cards, whatever it may be, we're here for you all year long. Quick timeline, quick agenda and timeline of open enrollment. We'll talk about medical plans. We'll talk about dental and vision. We'll talk about how do we enroll and then where you might go with questions. So our open enrollment period is from December 1st through December 12th. This is the time in which you can make changes to your enrollment. You can choose to go from one plan to the next. You can add dependents. You can remove dependents. If you decided not to enroll in the dental or vision policies last year but want to now, this is your time to do so. This is when you need to do any changes you want to make, this is the time to make them. Any changes that you do make will go into effect January 1st, 2023. Asking everybody to complete their enrollment no later than Monday, December 12th, and you'll do so online at the Ease Benefit Enrollment Portal. So we have 7 medical plans available, 4 HMO plans that are available only for the California employees, and then we have 3 PPO plans that are available for everybody. All right, so we have Harmony Network HMO plans, which Harmony is going to be a smaller network of HMO providers. Signature Network is a larger network of providers, so there's more providers in the Signature Value HMO plan. So just know that. Here's our Harmony plans. We have a silver and a gold plan. Our silver plan is going to have a higher deductible. Again, Harmony is going to be the smaller network of doctors. You'll see that the out-of-pocket max is a little higher, and then we have copays throughout. Now, what I'd like to do is kind of just touch on some of these terms and some of these numbers and make sure that you have an understanding of what they mean. When we talk about deductibles, you'll see here with the silver plan, there's a $2,400 deductible. A deductible is, generally speaking, what the insurance company says you must pay all of this number before we pay for any portion of the coverage. Now, 2,400 is the number here. There is exceptions to this. So if you see the DED waived in parentheses across the board here, so wherever it says DED waived, this means that you do not need to meet the deductible before getting these benefits. So under office visits, if I want to see a regular doctor, a primary care physician, it would be $60. If I want to see a specialist, it'd be $95. Deductible waived. I get that benefit right off the bat. I do not need to pay $2,400 before I get a $60 copay to see a doctor. With diagnostic lab and x-ray, $45, deductible waived. If I need a CAT scan, PET scan, MRI, $400, deductible waived. If I need physical therapy, occupational therapy, speech therapy, $60 copay, deductible waived. If you skip all the way down to urgent care, you'll see deductible waived there too. So this is a very, very good HMO plan because for all those regular services, lab, x-ray, doctor visits, urgent care, you do not ever need to meet that deductible. It's really fantastic. So for those of you that want to save some money but don't have a lot of big expensive things, you don't have hospital stays planned or anything like that, these silver HMO plans are fantastic for that. Now, if we skip down here towards the bottom, we see inpatient hospital services, outpatient surgery, emergency room, 40% after the deductible. What that means is after you pay the $2,400, then you would pay 40% of the cost. United Healthcare pays 60% of the cost until your $2,400 deductible plus your 40% equal your maximum out of pocket of $9,100. Once you hit this $9,100, which by the way is cumulative of everything we've talked about. So if you pay $20 for a generic drug or $45 for an x-ray, it's all rolling towards this $9,100. Once you have spent in total $9,100 on a calendar year, then you are no longer on the hook for any part of the cost for the rest of the calendar year. So that means that out-of-pocket number is very important. That out-of-pocket number really is the deal you're making with the insurance company that says, hey, at a certain point, You pay everything else, and I pay nothing else. All right. So you'll see how the gold plan is very different. No deductible. You're never out of pocket 100% of everything. $7,500 out of pocket maximum. That's much better than $9,100. $35 to see a doctor. $300 for MRI. No brand name drug deductible. But most importantly, down here at the bottom, there is a copay for hospital stays, for surgeries, and for the emergency room. So if we compare the silver to the gold, when you're gonna, let's say you're gonna have a baby, you'll be in the hospital 2 nights. With the silver plan, you'll pay 100% of the cost for the first $2,400. Then you'll pay 40% of the cost, not to exceed $9,100. So 2 nights in the hospital is probably gonna cost you $7,000, $8,000, $9,000. But on the gold plan, all you would pay is $700 for day 1 and $700 for day 2. That's $1,400. So while the gold plan will cost you more than the silver plan, think about how you're using your health plan. Think about what you can predict about what's happening soon, what's coming up as far as benefits you might need, as far as accessing providers, going to the hospital, getting surgery. If it's something that you can consider and assume that you're going to have some of these bigger expenses, please do yourself a favor. Please enroll in the gold level plan. Yes, it will cost you a few more dollars out of your paycheck, but when you go to use it, it's going to save you a ton of money. So when we look at our these HMO, on the Harmony HMO plans, United Healthcare has a special program for Harmony members where you've got kind of a concierge system, a one-stop call resolution place. So this is kind of an added value benefit that you get with the Harmony plans. That just wanted to share that flyer with you. Here we have our signature value HMO plans. So you have the same exact benefits across the board for each of these plans. The difference is going to be the network of doctors. So signature value HMO is a larger network of providers. So if you're living in Northern California, there might not be as many Harmony providers. Or if maybe you're in the Southern California area and there's lots of Harmony providers, but your doctor is not part of that network, you're going to need to choose the signature value HMO plan to get access to that doctor. Or you could choose a PPO plan. We have 3 of them. So we have our core bronze plan. This bronze plan, it's a very high deductible plan. It doesn't have as big of a network of PPO providers as the other 2. And basically you pay for absolutely everything up to $7,500. So this bronze PPO plan really is just a catastrophic plan, really only a good idea for those of you that are just wanting something in place in case something bad happens. You don't want to spend a lot of money on your plan. You never use your health plan. This bronze plan would be pretty good for you. But for those of you that are using your health plan that do have expected medical claims, I would be very wary of the bronze plan because, like I said, you're going to pay for everything up to $7,500. Our silver PPO plan, lower deductible, under $2,000, still got a $9,100 out-of-pocket max. We've got copays for doctor visits. We got copays for like physical therapy, occupational speech therapy. That's what this is here. Copays for chiropractic, $20 copay for generic drugs, $80 copay for urgent care. So still a good value plan. The deductible isn't too high. So good value there. And then, of course, our gold PPO plan. This is going to be the best benefits you'll find with a PPO plan. Much lower deductible, lower copays across the board. So those are our 3 PPO plans. So let's talk about just the app, the mobile app with United Healthcare. This is the #1 thing you can do to improve your healthcare experience. Download the smartphone app. When you have this on your phone, you never lose your ID card. You can find nearby doctors and providers. You can find urgent care facilities rather than emergency rooms. You can video chat with doctors. You can see your claims information. You can schedule appointments. It is a really, really helpful tool, and I implore all of you that are enrolled in the benefits to download this app. We'll talk a little bit about some of the added value benefits from United Healthcare. There is an EAP program. This is an employee access program. Really just an independent offering that allows you to check in with a professional, someone if you're having trouble with work-life balance, if you're having trouble with relationship issues, if you're having trouble with finances, drug or alcohol abuse, sometimes it's really difficult to know where to start, and this is a really great place to start. So you can call them 24/7 and they can help you out. They can talk to you one-on-one. You can even get up to 3 visits with the same person to work through some of your issues. So great place to start. And if you want help finding a mental health provider that you can go to on a regular basis, this is also a great place to start that journey as well. Apple Fitness Plus, so you're going to get a year free with your United Healthcare program. So 12 months of Apple Fitness free. This is really great. There's a lot of different workout types, and so you'll need to register on the website in order to get this, but nice little added value. More exercise stuff. So this is the One Pass program. So there's multiple different levels that you can enroll in, and for a flat dollar amount, you can go see many different gyms. So really nice program here. Again, this is free and part of what you're already paying for. So let's talk about dental real quick. So we have an HMO dental plans for our California employees only. HMO dental plans are going to cost you not nearly as much out of your paycheck, but you have much less choice of providers. So with HMO dental plans, everything is a copay. Every single thing that they can do is a copay. You'll see some pretty large differences in copays listed here, simply because every part of the tooth has probably 10 or 15 different codes and different costs associated with it. So HMO plan for California employees only, low cost, really great way to access the dental plan and get a couple of free cleanings. If you want more choice, we've got a PPO dental plan, much larger, national PPO network. This is available for all employees in and outside of California. Has a $2,000 per person calendar year maximum. So once United Healthcare has spent $2,000 in benefits on you, they pay nothing else, you pay everything else. 2 cleanings a year are paid 100%. If you need endodontics or periodontics, that's covered at 80%. And then some of the major services like inlays, onlays, and crowns, that's going to be a 50-50 split. So good PPO plan there if you need it. PPO plan is going to cost you more, but you're going to get a lot more choice of providers you can see. So let's talk about our vision plan real quick. Vision plan, we've got a pretty decent one here. You get an exam for $15 every 12 months. You get new lenses for $30 every 12 months. And every 2 years, you would get a $150 allowance for frames. All right, so for those of you that need vision coverage, this is a good one to choose. There's additional discounts for things like LASIK, hearing aids, all that kind of stuff. So good vision plan for those of you that need it. So let's talk about our enrollment. So we're going to be going to cdmtech.ease.com. Many of you have already been through this site before. You're going to be looking for this email here that's going to give you a button at the bottom that allows you to click it and you'll log in. Once you get into that system, you'll put your password, username and password in there. If you're having trouble logging in, there's a little button that says forgot. If you still have trouble, you can reach out to our office and we'd be happy to help. Once you get in there, you're going to be listing your profile information as far as your address, your social, your date of birth, all these things. You'll enter in information about your dependents. If you're on Medicare, you'll load that information in. And once you get through all that, you'll get to the medical plan section. And for those of you who have never been in the system before, you'll see an area that says specify your coverage. It's not highlighted like this. I highlighted it for your, so you can see it very easily. And then it'll be a check mark and an X. If it's the first time in the system, both of these are going to be gray. And you want to hit the check mark to indicate you wish to enroll, or you want to hit the X to indicate you wish to decline coverage. Either is fine. But if you do not hit the check mark, you will not be given these buttons to select the plans. So you got to hit a check mark so that you can scroll down and see the different plans available. For those of you that have spouse, kids, you would list all of them here, and you can hit the check mark or X independently of one another. You don't have to enroll everybody or nobody. Okay, so you can enroll just you and your spouse and waive for your kids, whatever you might want to do. Once you get to this section, you'll see hyperlinks underneath each of the plans that give you an idea of what the benefits are, links to finding doctors, links to the smartphone app, all kinds of different things. For those of you that have been enrolled in the past, it will be pre-selected in a big green box so you know exactly what you want. So for those of you that are renewing, this should be a very easy process. You'll go through the same steps for dental and vision. Once you're done with that, you'll get to a summary. You're going to review the summary, make sure it's what you want. You'll hit the continue button right here at the bottom. Then it's going to just take you really to DocuSign. You'll hit the sign forms button. You'll type your signature. You'll use your mouse on a desktop or your finger on a mobile device to sign. You'll hit next. It'll take you through the whole application and just allow you to click and insert your signatures wherever it's necessary. Once it's done, you'll get sent back to the top of the page, and there'll be a button at the top right that says Finish Signing. Once you hit that Finish Signing button, you'll get an email within a minute or so that says, thank you for submitting your benefit elections. Once you have that, you're all done. And we thank you for your cooperation in getting through everything. So what's the next step? You're going to be looking in your email for these ease invitation login. The deadline to enroll is Monday, December 12th. If you have any questions, you need any answers, we'd be happy to help. We're honored to be here for you. And it's a privilege to be your broker and your expert. Please lean on us if you need us now or throughout the year. Other than that, I appreciate your time and attention and wish you a great day.